Wales Gene Park is led from Cardiff University. It promotes and facilitates medical, genetic and genomic research, and educates and informs the public and health professionals about the issues and opportunities this raises. The Wales Gene Park works collaboratively with the charity Genetic Alliance UK, a membership organisation of over 200 patient groups, supporting those affected by rare and genetic conditions. One of our main areas of work focuses on patient and public involvement in genomic research. This presentation focuses on how the Wales Gene Park works closely with those affected by rare conditions to provide an effective platform to connect and mobilise the rare disease community in Wales, influence policy and prioritise rare diseases for government, NHS and research. Rare diseases have always been a key focus of the Wales Gene Park, and involving those affected is vital. Examples of how we do this include patient and family representation on Wales Gene Park's advisory groups, establishing a Welsh rare disease patient network to raise awareness and drive improvements, including an annual meeting and parliamentary reception, and helping patients and families establish support groups. Working with patients, families and patient organisations, we've been able to identify groups where there is no or little information and support available for specific rare conditions. Through a project called Building Rare Communities, we've been awarded external funding to help develop support groups and empower patients and their families to have a voice in decision making. We work with health professionals, patients and families to host information days and events to bring communities together, hear from expert speakers and most importantly, give families an opportunity to network and meet others affected by the same or similar conditions. Through involving those affected by rare conditions, the Wales Gene Park facilitates opportunities in areas including education, research and policy. Stakeholder participation in educational initiatives include Rare Disease Teaching Week and Live with Genetic Conditions. Speakers provide personal accounts of rare conditions, educating professionals about their relevance to healthcare and impact on everyday lives. The power of personal stories is widely recognised, being increasingly used in health to capture the individual's voice and experiences and promote patient-centred care. Established in 2008, Wales Gene Park's Living with Genetic Conditions informs others about genetic conditions and through personal experiences promotes understanding of the impact they have on everyday lives and on healthcare practice. Sessions begin with a genetics expert giving a talk covering some basic genetics and details about the genetic condition on which the session will be focused. This is followed by a talk from someone affected, such as an individual with a genetic condition, a family member or carer. Their personal narrative gives an insight into the impact the condition can have on an individual or family, providing a powerful account of how it affects them. Feedback from speakers indicates this is a valued opportunity for patients and family members to have a voice and improve knowledge and understanding amongst future health professionals and others of what it's like to live with a genetic condition. Patient and public involvement is a key aspect of Wales Gene Park's programme, particularly across education and engagement and prioritisation and development of research. The Wales Gene Park collaborates with patients and the public to involve them in rare disease and genetic research. At Wales Gene Park's annual meeting in October 2017, Wales Gene Park ran a workshop with members of the Rare Disease Patient Network to identify priorities and barriers that needed to be overcome in order to support people affected by rare and genetic conditions and their families to become more involved in research. This resulted in the development of the Rare Disease Research Gateway. Following consultation with the network, primarily patients and carers affected by rare diseases, the Wales Gene Park aimed to bring together information about genetic and rare disease research projects from many sources in an accessible way, develop functionality to search for disease-specific projects, collate information about different types of research, and create a network of researchers who could recruit participants and advertise studies. The design, development and usability testing of the Gateway took place between 2017 and 2019. The Gateway is the first of its kind in Wales, a platform hosting relevant genetic and rare disease research studies. Future plans for developing the Gateway include adding more studies, promoting its existence, and working to improve its usability for patients and families. Stakeholder involvement in a programme of public affairs, policy and campaigning has increased awareness, knowledge and political interest in rare diseases. This includes supporting the development and implementation of the Welsh Plan for Rare Diseases, the Welsh Government's Genomics for Precision Medicine Strategy, and an Access to Medicines Patient Charter. A Welsh Parliament cross-party group for rare genetic and undiagnosed conditions has been established, providing a platform to highlight issues. Genetic Alliance UK provides the secretariat for this group and works with members of the Senedd from across the political spectrum to raise awareness of rare genetic and undiagnosed conditions. There are many ways that you can become involved with the work of the Wales Gene Park. Please do email us to join any networks you may be interested in receiving more information about. Visit our virtual Wales Gene Park exhibition stand at the conference, or come along to one of our upcoming public genomics cafes taking place online, or visit the Wales Gene Park website for more information about any of the opportunities that may be of interest to you. Thank you very much.